Hello and welcome to the Dr. Julia Sen Health and Wellness Podcast. I'm Dr. Julia Sen and today I'm talking to Mr. Aaron Ng. Aaron is a colleague of mine. He's a consultant ophthalmic surgeon who works in the Worcestershire Acute Trust and also privately at BMI Droitwich, and also I'm very pleased to say is also seeing patients privately at my clinic in Worcester. Aaron, welcome to the clinic.
I'm glad to be here.
Thank you. I'm really thrilled to be talking to you today. You're our first ophthalmologist and our first male guest, so it's a real honour for you. Today we're going to talk about the areas that you specialise in. So ocular surface, we're going to talk lots about dry eye. And then refractive surgery, I think there's going to be a lot of people that are really interested in your techniques and your views on various types of refractive surgery. I think the majority of listeners to this podcast tend to be women in midlife, and I think it's in midlife and we start to see a lot of changes in our vision and our ocular surface. So I'd like to really talk about some of those changes and what can be done about them. I think this would be really helpful subject matter.
Okay, happy to share.
Okay, so let's start at the front. Let's start with the ocular surface. So most of us are going through our younger lives with absolutely no issues at all, and then quite often in midlife, we start to experience some dry eye symptoms. So our eyes can feel tired when we're not tired. They can be intermittently blurry. They can feel sore, itchy, red, and just really miserable. Sometimes people get watering, which sounds a bit counterintuitive, but all of these symptoms cause a huge amount of distress. So can you talk me through what's going on with our ocular surface and why that tends to happen in midlife?
So that's true. We are seeing more of this in midlife, partly because we have dry eye. We work a lot on the computer screen.
So how does that influence our tear film?
So when we use the screen, for example, or when we read a book, we blink a lot less. So as a result, the tears evaporate a lot quicker. Mm-hmm. And when you blink less as well, you do not have the spread of the tear film to be quite even on the surface. And as a result, you get dry eye, and prolonged or chronic dry eye can lead to blurry vision and affects your daily activity. Actually, dry eye is actually more common now. And we know that younger patients, teenagers or young adults at the moment, we are increasingly seeing dry eye in patients like that because of computer screen, use of computer screen, but also we see, I think we are in a generation where a lot of us are quite used to processed foods and not eating enough of, oily fish in our diet as well.
Yeah, the omega-3 has had a lot of interest, hasn't it? So how do you think the diet is it to do with the tear film? Is it to do with the meibomian glands, the oil glands? Where is the connection there, do you think?
So let's take a step backward. Let's talk about the tear film. The tear film is the first transparent layer on the surface of the eye that light hits and refracts, and it actually helps direct light into the nerve sensing or light sensing part of the eye, which then transmit the light stimulus, converts it into electric signals and sends to the brain so that you interpret what you see, what you make sense of the world. So it's actually a very important part. It also acts as a sort of defense mechanism, so prevents infection. As part of my role as an eye surgeon in the trust, I do see a lot of eye infections on the surface of the eye. So if you do have dry eye, you're more prone to infections. And not only that, you are more prone to visual disturbances on a day-to-day basis. And when you get an infection as a result of chronic dry eye, then you could lead to permanent visual loss. So actually, dry eye is a very important condition to treat. And a lot of people do not see it as a huge problem. A lot of people go through their life thinking, oh, I've got a bit of itchy eye. And that's quite usually the first type of symptom. And then they tend to rub their eyes. Again, a big no-no. And and it progresses. Now, the tear film consists of three important parts. So the water component that's produced from a gland just right about here, the oil part from the oil glands along the lid margins, and mucus from the conjunctiva, so the blanket overlying the white parts of the eye. So they form a little mesh, like a mixture, and everything needs to be in perfect composition to have a stable tear film. Now, when we talk about diet, we know that you need to have omega-3 in your diet to have a better stable tear film. But also, increasingly, we find that if you have balanced, healthy diet, less processed foods, you have a more natural gut bacteria, the diversity that you get. And that we know leads to better control of inflammation within our body. And animal studies have shown in research there's a causative link, but we couldn't. There's no research at the moment that identifies that in humans. But there is a correlation, and increasingly we find inflammation with disorganized gut flora or gut diversity, that you tend to see more rheumatoid type conditions, or in rheumatology or immunological conditions, and dry eye as well.
Yes, I'm really glad that you brought up the gut microbiome, because it's something that I'm really interested and passionate about. And it's interesting you were talking about the association between gut dysbiosis and dry eye disease and inflammation, because there's also an overlap between rosacea and meibomian gland dysfunction and ocular surface issues, aren't there? Yes. I think certainly in my practice, I'm seeing a lot more patients presenting with rosacea. So I think that's a really important correlation, and something that people can do in practical terms for their dry eye that's going to be helpful. Just really examine their diet, see where that can be improved. And not only will that improve potentially their dry eye and their gut health, but also their risks of other chronic diseases. I really like your description of the tear film. I sometimes compare it to, this is such a woman thing, baking a cake. So you have to have all the ingredients in the right proportions, otherwise your cake isn't going to turn out very well. It's probably a very un-PC thing to talk about, being a woman thing. I think that it's sort of that it's really important. It's not just that you have the components, but they've got to be in the right quantities to do that. And in the clinic, we now have a device that can look at all the various components of the tear film and how quickly they break up. So that's been a really exciting addition to our practice that you're going to be utilising on your patients to help them understand and treat their dry eyes. So now going back to sort of more medical treatments, what can we do to help people with their dry eyes? What sort of treatments do we have available?
So I will tend to advise patients conservative measures first. When I mean conservative, meaning something that patients can do on a day-to-day basis. So start with healthy, balanced diet, make sure they have more omega-3, and try and cut down on the processed foods. I know it's not going to be difficult to do a sudden hard stop. You just need to allow, build that into a habit. Perform warm compresses. So, and it needs to be a sustained heat release, roughly about 37 to 40 degrees. It doesn't need to be really hot. It's just hot enough to melt the blocked oil glands. I mean the oil within the oil glands itself. And that will help with the oil flow on the surface of the eye. Now that's only a small part of that. When you have water reduction or water deficiency within the dry eye problem, then you need to have tear replacement therapy, such as dry eye drops. We can retain more of your natural tear by performing punctal plugs. What it means is that plugging the drainage system as if you're plugging the sink, and you retain more water within your eye. At the moment, with current treatments we have in the clinic here, We have IPL, or intense pulse light, where we deliver light pulses on the surface of the skin to activate cells to help reduce inflammation and oil production on the eye itself. And I've seen it work in moderate to severe cases, and certainly we can deliver that kind of treatment to patients. And I would generally recommend it needs to be a course of treatment that tends to be more beneficial.
Yeah. Yes, the technologies are really exciting now, aren't they? And even artificial tear technology is improving. And when I qualified, all we had was hypermellows, which is shocking to think about now. A number of the tear replacements have preservative in them. What's your view on the preservative in teardrops?
I'll prefer no preservatives in any drops from an eye surgeon's perspective. If we can avoid that, then it's all the better. I prefer preservative free because think about it, you will be using these drops lifelong if you do have dry eye, and preservatives can cause low-grade inflammation, and we have seen some patients are more prone to that, and they develop scarring and difficult inflammation to deal with, and other side effects as a result of that.
So now I'd like to move on to the more refractive side of things. So I was very fortunate in that I never needed to wear glasses at all until I got into my late 40s, when I started to find that I needed a little bit of help with close-ups. So it's the classical arms not being long enough. And then progressively, I've become more presbyopic, as we would call it, as ophthalmologists, to the extent now where if I don't have, if I'm not using some kind of correction, I can't read a menu in a restaurant, which is really embarrassing. And it's, as an eye health professional, it's been a real revelation that I now understand, to a certain extent, what visual impairment must feel like, even to a minor degree. And I've very recently started wearing contact lenses that I'd like to talk to you about as well. But can you explain, first of all, why it is that we develop presbyopia? What's going on?
So presbyopia is our, most of the time, natural aging, and we lose our ability to autofocus, meaning ability to focus in things in the distance, at an intermediate distance, like a computer distance, and near. So when that happens, most of the time we lose our ability near first, and it just further affects more and more of your intermediate distance. So most people cope with increasing font size or wearing reading glasses to help them with that. There are contact lenses available that allows you to do that, and a combination of contact lenses and glasses. So contact lenses, there are uses for them, okay? But it's important that you have good contact lens hygiene to be able to continue using that. And it's also important that you maintain a good ocular surface. So making sure that if you do have dry eye, you sort that out first before going on to having contact lenses. And in fact, a good ocular surface or a moist eye is important for even your prescription. So if I do tend to see lots of patients where they have dry eye problem, and they go to the optician several times in a year, or several visits to try and get it corrected, is because the tear film is so variable that the prescription changes so often. And it is also important to get dry eye treated. Say if you plan to have refractive surgery or vision correction surgery, it's very important in prior to your laser refractive surgery. So if you intend to have laser.
So why laser in particular?
So laser, what it involves is it removes a bit of your corneal tissue, the transparent window to your eye, to alter the curvature to allow you to see a certain distance. So most patients that will tend to benefit probably a good 20-30 years out of this is when you have this in your sort of mid-20s, early 30s. They may have good vision. and there's a use for that. And laser has proven to be quite safe as the technology has improved.
But in terms of, is it some kind of damage to the ocular surface by the laser that makes people more susceptible to dry eye?
Yes. So ultimately, part of the risk of laser refractive surgery is it'll affect your corneal nerves. So the nerves of your eye are like your thermostat. Yeah, it detects on how dry the eye is and sends the information to the brain, and the brain then can respond to how dry the eye is by releasing more water. So if you affect the nerves, you're more prone to get dry eye because there aren't enough nerves to send that information through to the brain. Most people do manage that with some dry eye drops. Some patients may not have dry eye, but it's a risk that you need to be aware of.
Okay. So for somebody having laser surgery, laser refractive surgery in their 20s, they're going to get presumably a good 20 years, as you say, out of that, and then they'll need to wear reading glasses. A lot of people that are looking to have refractive surgery are in my sort of age group, when I'm finding that I'm struggling for different distances and switching between contact lenses, glasses, different prescription glasses. And for those people that are trying to find a solution for all distances, that want to be as free from glasses as possible, presumably laser isn't going to be helpful for them.
Yes, I would say, when you approach, say, age of 40 and beyond, I have to say everyone will have their own personal circumstances. So I cannot be quite prescriptive about, this is the only treatment you have. But majority of patients, once they reach 40 and beyond, and in fact, definitely 50 and above, is when you do have presbyopia, I would definitely recommend thinking about lens technologies instead. And lens technology is now so good that, you do surgery just like cataract surgery. So our natural lens is like an M&M or a Smartie. You get a envelope, a bag surrounding the natural lens itself. So what will happen is we'll make a little hole on the bag itself, remove the contents of the bag, and what's left behind is an empty bag, which we then insert the synthetic lens, and that stays with you for life. Now, how well you see it depends pretty much on the lens technology you use. So you can have what's called a multifocal lens, where you get distance, intermediate, and reading. You have the extended depth of field lenses, where you get distance, intermediate, and some functional reading, but you'll need glasses for small print. Or you get a monofocal plus lens. Monofocal plus meaning the lenses that give you distance and intermediate or computer vision, but you will need glasses for reading.
Okay. So presumably when you're seeing patients that are seeking refractive surgery, it's very much not a one size fits all. It all depends on what their visual requirements are, occupational concerns. I mean, it's the surgery is, straightforward in that cataract surgery that most ophthalmologists are performing every day. The technique is the same. Obviously, the lens has to be absolutely center, but there are certain compromises that you make with one of these very sort of high technology lenses, aren't there? For example, contrast, I believe, can be a bit of an issue in some lenses.
Yes, some lenses do have contrast issues, but again, like you said, it's very much dependent on the patient. So visual requirements very important. So a good surgeon will actually discuss all of that with you, trying to understand what you require on a daily basis. Will also assess your eye and make sure that there are certain contraindications to this type of technologies, and if there are contraindications, generally a very competent surgeon will tell you not to go ahead, and these are the lens options you can have. And then you need to have a appropriate discussion.
Okay, so what are the kind of contraindications? I know everything's relative, but what sort of problems might you be hesitant about performing a refractive procedure, other than the dry eyes that we discussed?
Dry eyes, it's it's not an absolute contraindication. So it is something that if you do have dry eye, you treat it to get it a stable tear film, and you get good measurements from the eye, and that's when you know it's good enough. So contraindications generally would be, say, if there's poor visual potential. What I mean by that is the outcome following a lens implant will mean that it's be less desirable or does not meet the patient's expectations, and that will be a contraindication itself. For example, someone with a corneal scar, for example, scarring on the surface of the eye, or scarring on the retina, or even a patient who has glaucoma, where you actually have field defects in the vision, and you may have contrast issues already with glaucoma. I would not recommend, a multifocal lens, for example. But you need to have that discussion with the surgeon. The surgeon will need to understand your history, your likelihood of developing certain conditions also in the future.
Yeah. So I think it sounds as though having a really comprehensive clinical assessment is really important. And I think that often with some of the very high volume practices, some of that may be lost sometimes. So, I always counsel my patients, because often my aesthetic patients ask me about refractive surgery. And I know I have several people that I recommend, including yourself. And I just say how important it is to make sure that whoever is assessing you is a refractive surgeon with a lot of experience, and that very detailed assessment, because vision's very complex, isn't it? And expectations can be quite hard to manage. And I think spending the time with patients to work out what it is they need, because I should imagine that these are also patients that can be very dissatisfied if what they're hoping for or expecting hasn't been delivered.
That's correct. And we only have a pair of eyes, so we've got to treat them like treasure.
Absolutely. Well, on that note, I'd like to say thank you so much, Aaron, for joining me today. Lots of information there, and I think people will find that really helpful and useful in terms of both their dry eye symptoms, if they have them, and also for people that are considering refractive surgical options. So yes, thank you very much.
You're very welcome.
Thank you for listening to the podcast today. I hope you've enjoyed it and found the topics that we've discussed really interesting. If you have any suggestions for topics you'd like us to cover, then please leave these suggestions in the comments boxes below. If you'd like to contact Aaron for an appointment or for any queries, then please email at hello@drjuliasen.co.uk. Thank you, and look forward to seeing you next time.